Hi, this is an OCR Gateway P4 question for Gateway Physics and for additional science. This question is about gamma rays and they're used to treat cancer. They rotate a gamma source around the patient. Look at the picture. So this machine rotates around with the patient sitting in the middle of it. This is a gamma ray source. So there's a beam, if you like, of gamma rays which rotates around the patient, continuously emitting that beam. And what they're trying to do is actually destroy a tumour which is going to be somewhere in the patient's body. This is called radiotherapy. You've heard of it. Explain how the treatment works and the potential risks and benefits that the patient must consider before deciding whether to have the treatment. There's two things I want to say about that statement. Well, whenever you've got one of these questions, this is a 6-mark quality of written communication question, you're going to see something like this. You're going to see 2 points around an and. So really they're looking for 2 clear paragraphs and that you can organise your writing around 2 clear paragraphs. That's all you need to really remember about that. And the next thing is, well, what does it mean by before deciding? Surely doctors just recommend treatment and give treatment. Well, actually, there are 3 ways that we treat cancer, one of which is radiotherapy. The other 2 are surgery, so you can actually take out the tumour, and the other one is chemotherapy, which involves taking lots of drugs and trying to slow the growth of the tumour. Don't get them confused. The one that you're going to talk about in physics will be radiotherapy. So I'm going to scroll down. I'm going to give you kind of 2 headings, and I want you to try and write a 6-mark answer within those 2 headings. So the first heading, I want you to explain how the treatment works. So how radiotherapy works. And think about that idea of the rotation of that beam. Why does the beam rotate? And then I want you to go into benefits and risks. Okay. And you could see that as pros and cons, if you like, or advantages and disadvantages of the treatment. It's absolutely fine. Pause the video, try and write some of your own ideas, then play the video and I'll show you some of the ideas that you could have written down. Remember, whenever you see this, you must write in full sentences, and they're looking that you can actually structure an answer well. How do you do that? Well, you pick two headings like I've done for you here. Okay, pause and have a go. Alright, well, how radiotherapy works? Well, it's this idea of rotation. Okay, why does the beam rotate? Well, it's a gamma ray beam, and the gamma ray can penetrate into the body to reach the cancer. Okay, so the gamma ray penetrates the body. You know, it wouldn't work if it was alpha or beta, because they wouldn't penetrate the body in the same way. Now, we're trying to aim it at a tumour so that the gamma rays destroy the tumour, the cancerous cells. Gamma rays destroy cancerous cells. But the problem is they also destroy healthy cells. Okay, so they also destroy healthy cells. So they rotate it so that it's not always the same healthy cells that the beam is going through. That's quite a hard thing to get your head around, but if you like, if we weren't rotating it, then it would destroy all the cells along that same line of action. So as it rotates, it's the different cells that the beam is going through, so therefore only a few of them are destroyed, or less of them are destroyed, but it's always going through the tumour, and that's the important bit. So it's focused on the tumour, so destroys less healthy cells. It's a hard thing to understand, or hard thing to explain at least. Okay, so like, why rotate it? The benefits and risks, well, there are side effects. Okay, there can be burning of the skin, or damage to healthy tissue, as we've talked about. But it could also destroy the tumour. It could also slow the growth of the tumour, or destroy the tumour. Okay, well, if we didn't have the treatment, then the cancer could spread. But if we don't treat it, then we won't have the side effects, and that's really the way up there. And it is always used, or usually used, in conjunction with two other methods, because there are times, sometimes it will be effective. When you write sentences, try and think about the choice that the person has, because their patients are usually offered the 3 types of treatment for cancer. They're told about them, they're offered them, and they come to their own ideas of what they want to have, because they're all invasive, they've all got positives and negatives about them. So patients really need to have their own choice about which ones they want to go through, or whether they would prefer to have less invasive treatment, but maybe the negative, that their cancer won't get treated. Okay, thank you.